Presenting this case of a complicated mature cataract, we see 360-degree posterior synechial of the vestibular pupil, injecting some mydriatic agent followed by the blue dye, following which the viscoelastic is pushed in the AC. We use an iris depositor to break the synecdoche first through 180 degree and then successively through the other side port, the other 180 degree. The AC is cleared of the air bubble and a nick is made in the anterior capsule with the help of a 26 gauge bend needle, following which we use a micro-rhexis forceps to create the capsular rhexis. In such mature intumescent cataracts, the micro-rhexis forceps is a very invaluable tool and helps in a controlled rhexis, pushing viscoelastic again and continuing with the capsular rhexis. The capsular rhexis is completed. Following which the main incision is made. In such intumescent cataracts, the hydrodissection is generally not required and we can directly use a dialer to dial the nucleus in the bag. Phaco is then started, and after aspirating the squamous cortex, direct chop is made and we can attempt get 2 halves, following which we make it into 3 pieces. Complete separation of the pieces is very essential, and then getting one piece up in the pupillary area and eating up the 1/4 nuclear fragment, dialing the nucleus again and again sub-chopping, getting the piece up in the pupillary plane and using the phaco probe to emulsify the piece. This is a relatively softer cataract. Again 1/2 sub-chop and getting the piece up and emulsifying the pieces. During eye, the cortex is removed with the help of bimanual irrigation aspiration cannula. Patient was a little uncooperative and hence the maneuvering was a little difficult in this patient. Making sure no cortex is left behind underneath the iris. Once the eye is done, a 3-piece IOL is injected in the bag. The first haptic is in a 7 shape and the second haptic is kept outside the wound and gently guided inside with the help of the irrigation and is dialed into the bag with the help of the other hand. Going below the IOL to clean up the PC. In such complicated cataracts, I have often found useful to inject some intracameral triamcinolone, which helps in the post-operative inflammation, giving a thorough wash post the triamcinolone injection and hydrating the ports, and that is the end of the case. Thank you, friends.